Autism. Diagnosis and assessment. A brief look. Initial screening and evaluation. A team effort. Diagnosing autism involves a combination of behavioral observations, developmental history assessments, and standardized screening tools. Here's a brief overview of the diagnosis and assessment methodologies for autism. Screening. Pediatricians often use standardized screening tools to assess a child's developmental progress during well-child visits. Standard screening tools may include the Modified Checklist for Autism in Toddlers, MCHAT, and the Autism Spectrum Rating Scales, ASRS. Diagnostic evaluation. If screening identifies a child as potentially autistic, specialists including a multidisciplinary team of psychologists, pediatricians, and speech therapists provide further comprehensive diagnostic evaluation. Developmental history. A detailed developmental history is crucial to the assessment process. Parents or caregivers provide information about the child's developmental milestones, behaviors, and any concerns they may have. Observational assessments. Clinicians observe the child's behavior and interaction patterns during the evaluation. They look for specific signs and symptoms associated with autism, such as difficulties with social communication, repetitive behaviors, and restricted interests. Diagnostic criteria. The diagnosis is based on the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. The DSM-5 criteria include deficits in social communication and interaction, such as difficulties initiating and maintaining conversations, and restricted repetitive behavior patterns, interests, or activities, such as repetitive movements or a strong interest in a specific topic. Additional assessments. Specialists may conduct additional assessments to provide a comprehensive understanding of the child's needs. These assessments aim to identify co-occurring conditions, such as intellectual disabilities, language impairments, or medical issues, ensuring a thorough evaluation. Essential assessment tools include ADIR, Autism Diagnostic Interview Revised, ADOS, Autism Diagnostic Observation Schedule, CARS, Childhood Autism Rating Scale, and VABS, Vineland Adaptive Behavior Scales. Key assessment tools. Understanding diagnostic approaches for autism. The ADIR, Autism Diagnostic Interview Revised, and the ADOS, Autism Diagnostic Observation Schedule, are essential tools for diagnosing and assessing autism spectrum disorder. The ADIR assesses language and communication, reciprocal social interactions, and repetitive behaviors through a structured interview with parents or caregivers, capturing detailed developmental history. For instance, it might ask about the child's early language development, their ability to initiate and maintain conversations, and their use of nonverbal communication. This method ensures consistent and reliable diagnoses across clinicians, making it invaluable in research and clinical settings. The ADOS, or Autism Diagnostic Observation Schedule, is the gold standard for autism diagnosis due to its accuracy and reliability. It involves semi-structured activities that allow observing social and communication behaviors through direct interaction, providing immediate insights into behavior. The ADOS empowers its users by accommodating varying ages and language abilities, making it a versatile tool for evaluating autism. Together, these tools provide a robust framework for understanding and diagnosing autism, facilitating tailored interventions and support. CARS, Childhood Autism Rating Scale, and the VABS, Vineland Adaptive Behavior Scales, are critical tools for assessing autism and understanding children's practical capabilities. CARS involves clinicians observing and rating a child's behavior across 15 areas, including social interaction, communication, and emotional responses. This method is instrumental in the early identification of autism, which is crucial for timely intervention. By identifying the presence and severity of autism, CARS provides a quantifiable measure that aids in creating personalized treatment plans. Its validated and widely used approach makes it a trusted tool among professionals. The VABS, or Vineland Adaptive Behavior Scales, measures adaptive behaviors, daily living skills, socialization, and communication to comprehensively understand a child's practical capabilities. Through a survey interview with parents or caregivers, VABS assesses the child's performance in real-life situations, offering a holistic view of their abilities and challenges in daily living. Together, these tools play a vital role in the diagnosis and tailored support of autistic children. Early diagnosis. Understanding the importance of early screening. Diagnosing autism requires a thorough evaluation by a qualified healthcare professional, and active involvement by parents or caregivers is essential. Early diagnosis and intervention are crucial for providing the best possible outcomes for autistic individuals.